Okay, cool. Well, I'm going to go ahead and get started. We might have up some more of us jump online here, but let's go ahead and get started. Once again, my name is Dr. Luke Reinhart. I want to start out by just thanking everybody for taking a little time out of their schedule. I know it's a late night. It's been a long day after a long weekend, and 9 o'clock at night. If you guys are anything like me, you're ready to hit the pillow and go to bed. But this is a really important topic. We're going to dive into sleep, and specifically sleep for your kids. This is something that we have experience with, not only as professionals, but as parents. I personally have been a chiropractor for almost 13 years now, which is crazy for me to think. And I always tell everybody when I started out, I wanted to be the sports guy, right? Like I'm pretty sure every guy did coming out of college. And then something happens that changes your perspective, and you have a child, right? So we had a first, I shouldn't say I, because I didn't really do any of the work, but my wife gave birth to my son just over 7 years ago, and you change your perspective immediately. All of a sudden, you become away from like, what is it going to do to? You don't want to spend time on the field helping athletes. You want to spend as much time with your little ones as you can. And so I got two boys of my own. Hudson is 7, Owen is 4. And, we've been through the challenges, right? We've all been through that first couple months where, your kid, the sleep may be normal for that child, but it's still not much. I will say Owen, he was 5 weeks premature, so we had to wake him up in the middle of the night to actually feed him. And so, we've been on little sleep. We know what it's like to not sleep through the night. And we know it's like to have a child who's tired as well. And so I also want to introduce Halle tonight. Halle, I'm going to let you kind of pass the baton and tell everybody a little bit about yourself.
Sure. My name's Halle Markwas. I'm a certified pediatric sleep consultant with a company called Sleepwise Consulting. I also have a little one, Lane. He is 18 months last week. So for those of you that have or have had a toddler, I am in the very rambunctious, challenging stages of having a small boy who likes to flip over everything, run over everything, and he has a lot of energy that I get to keep up with. So I actually come from the hotel industry, but after having Lane and having some of our own sleep challenges, I did a lot of research and a lot of studying to help him sleep through the night. And in that process, learned about how I could help others and went and got my certification through the Sleep Sense program. So that is what I'm doing now. And I absolutely love it. And I love each child and family is different. So to me, every person is like a puzzle, and putting together those pieces to come up with a solution is really fun.
Awesome. Well, let me share my screen here and share some of the slides. Maybe. Almost there. There we go. Okay. Awesome. So before we get started and start sharing some of the information we have tonight, just some housekeeping stuff. Everybody should see there should be a chat box somewhere on your screen. If you have any questions at all during our conversation tonight, the chat box is where to ask them. What we're going to try to do is, we know that there's it's a late night already. We know there's a lot of people who want to try to watch it and get to bed as quick as they can. If you have a question, put it in the chat box, and we're probably not going to answer the question while we go through the content tonight, while we go through the information we have for you. But what we will do is we'll stay up and we'll answer any questions that you guys have after we get through. So those who are ready to jump off and go to bed and get ready for tomorrow can do that. And those who have some more information, we can do that too. But please feel free to do that, and we'll make sure we stay here and answer any questions we can after we're done. And kind of like we talked about, we both get it. We both are parents. We both have our own kids, and anybody who has had a child who isn't sleeping through the night, when you're getting a couple hours here or there of sleep, it takes a toll not only on your child, but it takes a toll on everybody in your family. I know when I was exhausted, I'm sure I'm not the best person to be around. I'll be the first to admit that. But it really is, it's not just it doesn't just affect the child, it affects the whole family. And I think that's part of the reason we're so passionate about what it is we do, because we get to see changes in one person, but it really affects the entire family. What are you going to get out of tonight? One of the first things we're going to talk about is why is sleep important? What is a normal sleep schedule? What does that look like? We always hear, I hear patients all the time, like have conversations like, oh, my child's sleeping, this much or gets up this early. And when we kind of talk it out, like that's still might be a normal schedule for that child based on what age they're at. What are your options? A lot of times one of the things that I hear patients tell me is when they go to their pediatrician, they talk to their pediatrician, hey, my child's not sleeping. My child's waking up 5 or 6 times every night. And the typical answer that they get is, well, they'll just outgrow it. That's not always a great answer. There's not a lot of great options out there for parents. And the pediatrician, in their defense, they really just don't have a lot of great tools to help that. So we're going to talk about the options that you have as a parent. 7 tips for master sleepers. This is Halle's domain here. She's going to go through that and really give you some great stuff you can do starting like tomorrow. What are the underlying causes of sleep problems? And if so, how do we find out? Are there other issues that could be involved causing your child to be able to just not calm down, not disengage, and not actually get into not only just not being able to fall asleep. When we talk about sleep, you have to be in this deep, restful sleep and not just this kind of low-level sleep. So we're going to talk a little bit about that tonight. We're going to talk about some success stories. I got this cool Hope Dealer shirt on, but there's hope for your child. Like I've talked to patients who have had this problem for 3, 4, 5 years, and it just doesn't seem like there's any hope that their child's ever going to sleep. I will tell you, if we can do one thing tonight, is hopefully it's give you a little bit of hope that there is a chance that you can actually get a full night's sleep. That being said, we always hear people say knowledge is power, and that's kind of a half truth. Applied knowledge is power. I think Halle will agree with me. If we go through this information tonight and you learn it and you get off and think, oh my gosh, that was amazing, that was great, but you don't do anything to act on it, we've kind of failed you. So our hope is tonight that the information you take some notes. We're recording it right now. If you're not taking notes because you're in your PJs, you're laying in your pillow, I get it. I'm with you there too. We're recording all of it, so we're going to send out a recording on YouTube. You can rewatch it again if you want to take notes or catch something that you missed again. But take this information tonight and apply it the best you can. And if you need help, we're here as a resource for you. So some general things that we see kind of right off the bat. What are some of the issues that I see? Most oftentimes what I see, and Halle, please feel free to jump in if you have anything that I skipped here, but one of the most common things I see is not sleeping through the night uninterrupted. My child still wakes up 4, 5, 6 times, and just my little girl never seems to sleep through the night. Or maybe it's not that they necessarily, once they get to sleep, they can't sleep through the night, but it is like a fist fight to get people to actually lay in bed and fall asleep. I hear parents all the time say, I literally have to like bear hug my child to get them to just sit still and try to get them to calm down and actually fall asleep. Still wetting the bed after potty train. Like that's a big issue as well. There can be some underlying issues there. I'm working with an 8 or 9-year-old right now that's still, not sleeping through the night because they still have accidents. And that's another thing that their pediatrician just said, they're going to grow out of it, but they're not growing out of it. So what else is happening? Is there something, Halle, can you think of anything else that I missed? Anything you hear frequently?
No, I would say for me, the most common is not sleeping through the night with infants. But a lot of times with toddlers and younger children, it's maybe they were an okay sleeper when they were a baby, but somehow mom and dad have made it into the toddler years and put up with it. And then if they didn't have the sleep skills coming into the time that they had the ability to get out of their crib and or talk, it just becomes even more difficult. And then that's when you start having more problems with getting them to sleep in the first place.
Yeah, that's a very good point. And if there are parents out there that have other issues, put it in the chat box. Let us know what kinds of things you're dealing with as well. So what does sleep actually do for your child? I'm going to pass the baton off to Halle here. I'm going to let you cover this in the next few slides of what normal sleep is. But this is really, really important stuff because sleep is so important for your health from so many different perspectives.
Yeah, this is a good slide because it's what does sleep actually do for your child, but it's also for you. So if your child's not getting the sleep they need, you're probably also hopefully not getting the sleep that you need. Hopefully you're not sleeping while the child's, hopefully you are not sleeping while the child is not sleeping. But these are particularly important in these developmental years because they need those deep stages of sleep that Dr. Reinhart was talking about originally. It can't just be the surface level sleep because they cannot have the proper growth hormones released in those surface level sleep cycles. They have to be in those deeper stages of sleep, and they can't get there if their sleep is fractured. So some important things: producing growth hormones, building their immune system, increasing blood supply to their muscles, restoring energy. We know that from our own sleep, that you need sleep to restore energy. That's a no-brainer. Builds and repairs tissue, reduces crying spells during the day. This is actually really interesting. If anybody wants any more information on that, I can send you some data and some studies on that, but that's always an interesting one for parents. And also allows for growth mentally and physically, like I said when we kicked off on this slide. All very important to development and continues into adult years. So this, I think, can be a shocker for especially parents of toddlers. I think most people, they think newborns sleep all the time. But I think that sometimes when you look at these averages for how much total sleep a child should have during the day, parents of kids, I would say like 6 months or older, start thinking to themselves like, wait a minute, my child is not getting this much sleep. So these are the sleep numbers published by the National Sleep Foundation. 0 to 2 months, they should be getting 15 to 18 hours of sleep. This isn't a 24-hour period. And all the way up into a year old, easy way to think about it, they should be sleeping more in a day than they're not. And I think that is a big shocker to people, especially as you start getting close to 1. Kids start struggling with naps, and so their naps aren't long enough, and they're getting to bed too late at night, and so their nighttime sleep isn't long enough. So I'll be interested to see if anybody has any questions about that, because that's probably one of the biggest surprises I hear back from clients is, wow, they really need that much sleep still, and they do. And then, so like I said, even up until 3, when they drop that first or that one last nap, you're still looking at 11 to 14 hours of total sleep in a day for toddlers. That's good on that one. And so this one's also really helpful when we talk about infants. What is normal? I was actually chatting on the side with one of the attendees that I know from some other classes, and she was mentioning that she's struggling with naps. She has a very young baby, and so I commented back to her, you can't have nap problems yet, because when you have a child that is less than 12 weeks old, normal is abnormal because they're still learning. So normal for a newborn, 0 to 3 months, is still to wake up 3 to 5 times a night. It's once we start getting older than that, then we want to start reducing those night wakings so that sleep is more consistent and less fractured. Newborn daytime sleep is inconsistent. That's what I was talking about with this newborn. A nap could be 20 minutes to 3 hours. Our goal is to set good intentions on trying to lengthen those naps, but they're not always where we want them to be. And naps should start to lengthen between 4 and 6 months. And in general, sleep should start consolidating a little bit more and become more consistent. So if you have a child that is older than 4 to 6 months and you do not have consistency, then you definitely need sleep assistance. You need some intervention. And just a note that most toddlers stop napping around 3 years old. So that's a pretty common time to drop that last nap. And that's normal.
So when we look at what are the options, that's once again kind of going back to that. My pediatrician tells me that they'll just grow out of it, but they're not growing out of it type of a thing. Sleep training and melatonin are really the two big options right now. Halle, I'm sure you're going to talk a little bit more about that a little bit later, sleep training.
Mm-hmm.
I'll let you go through that. Probably go through that in the 7 steps of the.
Sure. Yeah.
Yep. But, melatonin is the other option. And melatonin is a hormone that helps regulate the sleep-wake cycle. It's primarily released by the pineal gland. Most people take it as a supplement, but, right now there's not a ton of research for or against. It's kind of one of those things that, most parents don't like to start just giving their kids pills or supplements when they're young. But what other options do they have? That's what I hear a lot. And so most people on this webinar are probably thinking, why the heck is a chiropractor leading this? Why is a chiropractor talking about this? And it really breaks down to what it is we're actually doing with chiropractors, because chiropractic is an option for a lot of parents. Most people, when they think about chiropractors, they think neck pain, back pain. They think if my neck hurts, if my back hurts, that's when we want to get adjusted. And really it's about how your brain and how your body are communicating. We feel about 10% of our nervous system. 90% of our nervous system is communication, how our brain communicates with our organs and how our brain communicates with our muscle. When we look at those nerves, they're actually broken down into 2 branches. One branch of our nervous system are called our sympathetic nerves. And our sympathetic nerves are our fight or flight response. They're the nerves when we have stress, whether it's physical stress, whether it's emotional stress, whether it's chemical stress, doesn't matter. Their job is to get us ready to either fight that stress or run away from that stress. The example that I give every single parent that comes into my office is, let's imagine right now that there was a bear in the room with us. What would happen to our body? Our heart would start racing. We start pumping adrenaline. All of our energy goes to our arms and our legs. And we're either going to fight the bear or we're more likely going to run away, right? So while we're running away from the bear, are we worried about fighting off the flu bug? No. We're worried about taking a nap or going to sleep? No. We're worried about digesting our lunch? No. We're worried about growth, development? No. All of our energy is 100% protection mode. So the other side of our nervous system is called our parasympathetic nervous system, and that's our body's natural brake pedal. Super, super important when it comes to sleep, not only just falling asleep, but getting a deep, restful recovery sleep. Your parasympathetic nervous system is also in control of digestive system function, immune system function, like I said, sleep, growth, development, and recovery from injury. This balance is key to really helping them sleep, because a lot of times we see that children are just stuck in fight or flight, gas pedal all the time, all gas, no brakes. And when we talk about the nervous system, we use technology. We're going to talk about, you see one of the scans here. We're going to talk a little bit more about this in a minute, but we use technology to really assess to see if that's part of the problem before we get started, to see if it's something we can help with. I'm going to preface this next slide because if you get a little bit of a queasy stomach, it is a little bit rough to see, but where does it come from? The biggest thing that we see is some kind of birth stress and birth trauma. And let me also say this, that I'm not anti-intervention. I'm not anti-C-section. I'm not anti-forceps. I'm not anti any of those things. But the reality of it is it's not only really stressful on mom. We always think about how stressful it is on mom, which it absolutely 100% is. But very, very rarely do we think of how stressful it actually is on the baby. This picture right here is very telling, because when we look at these doctors' hands, kind of right here where his fingers are, that your body's major brake pedal nerve, it's called your vagus nerve, that's where it exits your spine. So if there's some kind of stress, some kind of trauma from day one, most of these kids are all gas pedal and no brake. Now, maybe they didn't have a C-section, maybe they didn't have intervention, things like that, but oftentimes there's some kind of stressful event that has their gas pedal stuck on and doesn't want to shut it off. So in our office, we've invested in technology that helps us really capture a picture of the nervous system, since 90% of it you can't feel. And even if you could feel it, how well is a 1-year-old or 2-year-old going to tell you what's going on with their body? They probably can't communicate that very well. And these scans really tell a story for us. So the first scan that we use is thermography. The same nerves control organs, glands, and tissues, also control blood vessels. So if there's a heat temperature differential, it can help us get an idea of where that nerve stress is. When we look at this, we want to see areas that are white. Green is a mild stress, blue would be a moderate stress on the nerve, and red is severe. So we see with this scan right here, at the very, very top where that brake pedal is, you kind of see it feeds right back into the brain. But if there's a stress there specifically, that's a really good indication that these kids are all gas and no brake. This is an essential part of our, not only our initial evaluation, but our re-exams to make sure that if there is something, some kind of stress there, that it's changing as we go through care. And then the other thing we use is heart rate variability. So believe it or not, your heart rate actually changes when you breathe in and breathe out. When you breathe in, your lungs expand. It puts stress on our heart and speeds it up to some degree. And when we breathe out, it takes stress off of our heart and should slow it down. And that's a function of that sympathetic, parasympathetic, gas pedal, brake pedal balance. We want to see how well the two are working together. We want to see if you have stress, you can get ready to manage the stress, but you're more importantly able to disengage when that stress is gone. Once again, oftentimes this picture here on the left, you see the scan here on the left, that would be an indication that whoever has the scan is stuck in fight or flight. Their stress response system is just stuck on all the time and not able to come off. And this is the other biggest question that I get. And this is a video of little Noah here. Oftentimes we say, well, I've seen my chiropractor adjust me, or I've seen my chiropractor adjust my husband. Like, well, I don't want my child to have that happen. So pediatric adjustments are significantly more different than what an adult is. This is a quick video I shot. Just play this for you real quick if I can bring it up.
Hey everybody, it's Dr. Reinhart. And one of the questions, one of the biggest concerns I get from parents when we talk about pediatric chiropractic is, what are you going to do with my child, right? We've all seen those videos on YouTube. We've all seen some of those crazy things that scroll through Facebook. And to be completely honest with you, I wouldn't want to get adjusted that way, let alone let my child be adjusted by someone who's doing that to my baby. And so what we want to do today is we're actually going to show an adjustment for Noah here. Show some of the tools we use to make the adjustments, and kind of show you how gentle a pediatric chiropractor actually should be. Okay. So one of the things we use, this is called an arthro step. It has a little tiny tap right here. What we do is we find the misalignments anywhere in the spine that there's a joint out of its normal position, putting some degree of stress on the nerves. We use this, and we just do a slight tap on some to make the correction. So we're going to go ahead and do that here. You ready? Are you ready? So you just kind of start feeling the spine, feeling how let's show you some of the other tools we use here. First, a lot of times I go by the scans we talk about in the office. You see previews of those. Help me really kind of localize where those areas of nerve stress are. We're just looking for areas where the spine's not positioned correctly to take some stress on the nerve. And that's all it is. Tell anything's happening, it's so gentle. Yeah. See yourself. But one of the other tools we use a lot of temperature. You've seen the thermal scans before. They help us really, based on temperature differential, how different it is from one side to another. You can get an idea of where the nerve stress is and how severe the nerve stress is. But the cool thing is, especially in the upper part of the back, where those are these really important nerves, like the brake nerve, we talk about sleep, we talk about ear infections, we talk about ADHD, stuff like that. A lot of those sensitive nerves are up at the very top of the neck. See pretty quickly, see a change. So we find some misalignment there. sometimes it's all that simple. So you do a good job. Yeah. But that's how a gentle pediatric chiropractor can be. Shouldn't hurt the child at all. No bending, no twisting, no popping instruments. And yay, say hi. And really makes a big difference. Have a good day.
So that's what an adjustment looks like for a child. If we find areas where there's stress, we can use the technology to localize that. We can make the corrections. Then we can recheck to see if we're making the changes that we want to see. And hopefully it makes a child, the biggest thing we see is oftentimes they start to calm, they start to relax easy, falling asleep on their own, and things like that. So I'm going to pass it back off here, and we're going to go over the 7 tips for master sleepers.
Great, thank you. So I like to think about some of the things that Dr. Reinhart's been talking about as a way to set our child up for success. Some of the things that I also talk about for that are making sure that their sleep environment is ideal. And if anybody has questions about that, we can talk about that offline afterwards. But making sure that they are in the best position possible to start practicing independent sleep skills. So what I'm going to talk about in these 7 tips are steps to get them towards practicing those independent sleep skills. The first one is to identify any sleep props that your child has. The most common sleep props are nursing or bottle feeding to sleep, mom or dad or another caregiver being a sleep prop, whether that's your arms, dad's special song, mom's special sway, whatever that might be. Those are the most common sleep props, but there are lots of other ones. So identifying what that sleep prop might be. Most children have more than one, if they have them at all. And then working on getting rid of those external sleep props so that they can learn to fall asleep independently. The second tip is my husband and I always joke there's 2 kids in our neighborhood who are always out like riding their bikes like by the time we're in bed. And I'm like, those kids do not have an early enough bedtime. Early bedtime is good for everyone and for mom and dad too. When the kids are in bed, that gives you time to be an adult, not just a parent. But we recommend 6 to 8 p.m. The only time this would really be different is if your family has a really strange, non-traditional schedule where, if mom and dad work like a strange shift and everybody goes to bed a lot later and gets up later. But honestly, in my entire time working with clients, I've never had that situation. So 6 to 8 is where we want to be for bedtime. Bedtime routines are huge. For anyone that has a toddler, routines for everything are important, but particularly for bedtime. And you can start this from day one, is just practicing a bedtime routine. I recommend that they're 20 to 30 minutes long. Any longer than that, and you can risk a child getting a second wind and spending too much time, especially as they get older. They start to feel in control of the situation, and we never want that to be the case either. And bedtime routines are a great cue that bedtime is coming. So we want this to include a bottle or nursing, if that's age appropriate, a bath, jammies, story time or song time, and bedtime. So nothing complicated, but something routine that happens every time to signal bedtime. And anyone should be able to do this bedtime routine, not just mom, not just dad. Could be the neighbor, grandma, anyone. And that's also part of having independent sleep skills. Number 4 is a nap time routine. And you can basically what you do exactly the same thing for bedtime, but shortened. So I'm talking 5 to 10 minutes, diaper change, 1 story instead of 2, put them into bed, but it's at least a little bit of a sequence to help cue them that nap time's coming. And then just another note that darkness can help extend naps. And so especially when we start getting older kids who can think a little bit too logically about the situation they're placed in. So kind of anyone, I would say around 8 to 9 months or older, that can be really helpful to help cue them because they're like, wait a minute, it's daytime. I don't need to be napping right now. So it's a good time to practice that. And then to remember, this is very common for grandparents to be saying things like, oh, they've had such a busy day, they're going to sleep like a rock tonight. And really, sleep begets sleep. So naps are really important. If you skip naps, you're likely to have an overtired baby, and that will not cause them to sleep that well that night. And tip number 6, oh, you're fine. No, tip number 6, night feeds. So very common, if I ask a typical group of new moms, how many of them nurse or bottle feed in the middle of the night to keep their child asleep, most of them will raise their hands, but we actually want children to be awake during night feeds. We just want to keep the environment quiet and low key, low lights. We actually want to avoid letting them sleep while they're eating. The point is for them to eat, not to sleep. Otherwise, that night feed does not have a purpose. So that's a little bit about night feeds. I usually get questions on that, so I'm happy to answer them. And number 7 is consistency. Anything that you choose to do, we ask you to be consistent, because it is very easy for a child to be confused if mom responds one way, dad responds a different way, or mom responds one way on night number 1 and on night number 2 responds a different way. Your child has no idea what you're trying to teach them, and all of the effort that you're putting in is really for naught if you aren't consistent with whatever you choose to do. So those are 7 tips for master sleepers.
Awesome. Well, I want to share a couple success stories we have here. We'll kind of hop back and forth. I'm going to start with Reese. Reese is a little guy that started in our office probably last March or so. And mom brought him in because he was not sleeping, right? He would have a difficult time falling asleep, more difficult time staying asleep. He'd wake up 4 to 6 times every single night. When we ran initial scans with Reese, this is what they look like when we started out. Once again, when we look at the scans, we want to see white. Green is a mild stress, blue moderate, and red is severe. So when we look at these brake pedal nerves, where do they exit your spine? Very top and very bottom. He had stress on both ends. And so just to stress out a little guy, I'll gas pedal and no brake. This is after a series of care. We ran some post scans, and this is really what we want the scans to look like. All white, that severe stress gone. And after we cleared out the stress, started sleeping through the night, started going to bed easier. It wasn't a fight at night anymore. And the whole family finally started getting a full night's sleep without waking up 4, 6 times.
Cash was a monkey. He was 21 months and was already out of his crib, into mom and dad's room. The mom of Cash, Natasha, her words to me were, this is her only child. She was an older mom. And she said, this is not what I thought motherhood was going to be like. And that was a very sad conversation for me to hear a mom that felt that way. This was probably my hardest, actually, family to work with, because Cash was at a really tricky age. He was old enough to talk. He was old enough to show some defiance, but too young to understand staying in his bed. So he was a tricky case, but he, in about, I would say he was 2 weeks and some change, maybe we'll say 16 days. He was sleeping through the night, and prior to, Natasha had to rock him to sleep and it could only be Natasha. So that's also exhausting. I don't know how she made it almost 2 years doing that. And so by the end of it, he put himself to sleep. Bedtime was peaceful, and he would sleep through the night without getting out of his bed and coming to get mom and dad. So that was a good one for me.
Awesome. So here's Jackson. Jackson, same kind of thing. Before we started working with him, he was waking up 5 or 6 times every night. With him, it happened really quick, started sleeping through. It's funny because I remember mom's first words were, I don't know if this is a coincidence, but, and I'm like, no, it's not a coincidence. This is really happening.
Never a coincidence.
Right, exactly. But started sleeping through the night right away. And then Thea, she always cracks me up. She's like the best. But same kind of thing with Thea. She, when she first came into the office, 5 or 6 times every single night, she would get up, She would, her mom was trying to bribe her with jelly beans, and she would never get her jelly beans because she would never stay in bed. And, but
no.
once we started working with her, once we started calming down her nerves, calming down her nervous system, engaging those brake pedals, she went from waking up every single night several times to sleeping through the night.
So it's kind of funny. Dr. Reinhart picked these out of my, so I didn't choose these testimonials to put up here, but you chose my longest case and my shortest case. So Rowan, children that are 4 to 6 months are usually the hardest because they usually have gone through their 4-month regression, which is why their parents are calling, but they don't have a lot of skills yet. And Rowan was like, she was ready. She wanted to sleep so bad. And she slept through the night. I think she was waking probably 3 to 4 times a night for her mom who was nursing. And by night 2, she slept through the night, which is faster than I've ever seen a child. So Rowan was ready to go. It was mom that was holding her up, I think. But she took to everything really quickly, and I still talk to her mom, and she is doing awesome. And I'm pretty sure she has that face every day. So she's doing really great. And if any of you, since I don't know how old anyone's children are, if any of you do have an infant, I just want to make a really quick note. And I don't know, Dr. Reinhart, if you see anything on your end around this age, but the 4-month sleep regression is the only biological sleep regression that happens in a person's life. So every child goes through a 4-month sleep regression. We often hear people say 4-month, 8-month, 12-month, 18-month. They make up regressions because they're just developmental like hurdles. But a 4-month is a biological change in their sleep pattern. So that's why we see so many sleep changes around that time.
Question, just random question. What about like teething? Because I hear a lot of times parents say that, hey, my child's teething and they've had a sleep regression, and they're generally probably maybe that 8 to 10 month range. What I guess.
Good question.
So I off script here. I apologize.
That's okay.
Bringing this right on you.
The trick with teething, like illness, is sleep is a behavioral issue. So typically what we see there are things, traveling, illness, teething, developmental changes like learning to walk, learning to talk. All of those things can cause hiccups. But if your child truly has independent sleep skills, those hiccups will not last for nights on end and cause a regression. I think that it's an easy way to talk yourself out of something that's happening if you can say, well, they're teething. Well, they're teething for years. So if you keep using that excuse, but they don't actually have independent sleep skills, it's really just going to be a vicious cycle. So we certainly, if they're sick, we take care of them and we provide some additional comfort, but we really, if they're sick or they're teething, they need sleep to move that process along. So we want to encourage sleep and not enable them. Does that make sense?
That makes sense. No, it's a great, love that. And I don't know, I'm sure you are the same way, but these are always like the best part of my day. When I get the text from mom saying, oh my gosh, like, I don't know what you did last time, but this is from a mom. She texted me, she brought her boy in and wasn't sleeping. And her text was, I'm very happy to report that Ethan asked to go upstairs for bed 45 minutes early last night, which is unheard of. No nightmares, which once again is nightmares are another sign of that fight or flight response system, stress response system always being engaged, not just in children, but sometimes in adults too. But no nightmares. He got up at 12:15 to go to the bathroom, which is normal for him, but went back to sleep until 6. So she was super excited. Here's a picture of a scan we did right before his adjustment. And you can see once again all that stress right at the very top of the neck where that brake pedal nerve is really kind of one of the big things for Ethan. So I just want to wrap it up tonight. Thank you for those of you who are still on. We know that once again, it's a late night. It's a lot of things you could be doing, but when it comes to your child's sleep, if it comes to anything for your child, we get it, what it takes as parents. Hopefully you guys got some information. One of the things that I hear from parents when we do webinars like this is, what's my next steps? What do I need to do for my child next? And ultimately, can chiropractic help a lot of these kids? Absolutely. Can make an appointment with Halle help a ton of these kids? Absolutely. We see the best results. The best results happen when you do both. If I'm working with a child, but their sleep schedule is off, it probably isn't going to be optimal. If I was working with a child and there's some fight or flight gas pedal stuck on, it's going to make her job a lot more challenging. So what we're doing tonight is what we're offering is a consultation with both of us for one set fee. $47. What that will include is a complete exam with me, include all of our scans, and a 15-minute consultation with Halle to talk about your kids and see if it's something that her services could help your child and help your family start to sleep better. If you have interest in that, please reach out to me directly. My email is luke@proactiveohio.com. Should be getting an email too. If you go to our website, proactiveohio.com, you can also request an appointment through there. We'll make sure we get you guys connected with both of us, and we'll kind of find out where that hiccup is and what's going to be the best for your child. Halle, is there anything else that we missed? Anything else you want to cover for parents before we sign off for the night?
I just want to address Amanda. She's still on here. She had asked a while ago, is it normal that a child used to sleep through the night until around the age of 2? Now it's a fight to get to sleep, and it's not consistent that he sleeps through the night. Do you want me to answer that from a normal perspective?
Absolutely.
Yes. I have heard that many times, Amanda. I don't know if you're able to unmute her if she wants to respond. I don't know how that works. I'm not the technology person here, but yes. I was saying earlier that a 4-month sleep regression is the only biological sleep regression. The only other one that I will ever talk about, because it sort of has a little bit of validity, is an 18-month sleep regression. And that sleep regression is related to the fact that around 18 months, so this can really be anywhere between, I would say, 16 months to 2 years-ish, maybe a little bit less, they start to learn that they can manipulate you, and they don't mean it in a bad way. We think of that negatively. They're just learning that skill set. And so something that they maybe used to be able to do just fine, they're like, well, hold on a second. I tried fighting bedtime and mom caved. I kind of like this. I can hang out with mom a little bit longer. It's just that they now have the mental capacity to push back. So it is very common around 2. And so then a lot of times what we have, I see like on Facebook, I'll see parents ask this and other parents say, oh, it's time to move them to a toddler bed. It is not time to move them to a toddler bed. Do not do that. And there's a lot of other suggestions around this age that are not appropriate. There's usually other things at play that need to be corrected first. They do not have the emotional maturity to move to a toddler bed yet. And that is almost always what people do because they think it'll make them happier. So I hope that you haven't done that yet. But yes, it is somewhat normal to hear of a child that did sleep that is not sleeping once they were able to kind of realize that they could manipulate mom and dad a little bit more.
And I will say from a neurologic perspective, as kids grow, what we hear, the story we hear, oftentimes changes. So when we look at the nervous system, so complex, so vast, that different stages have different things. Oftentimes what we hear is colicky baby, not sleeping, crying a lot, which leads to ear infection, sleep issues, behavior issues, high energy, to when they get to like the grade school, it's more trouble focusing, more trouble sitting still, potentially even like learning challenges or even sensory type of an issue. They're very sensory seeking kids and eventually if that still goes uncorrected, it leads to more like even like the headaches and migraines and things like that. So I would say that when we look at nerve stress, it's not one certain nerve stress is the same for every single child, but there's just general progression that if there's something there that just has been there for a long time, as the longer it's been there, the kind of the how it shows up changes is a little bit different. Hopefully that maybe answers your question a little bit too. They may have been sleeping through the night. Maybe they were colicky, but they were great sleepers, right? But then they get to 2, and now their fight or flight's more kind of snowballed, if you will, and now they're having trouble sleeping.
So I see that Amanda had a follow-up on that. So Cash, the one that I talked about, that I said the mom, Natasha, she did the same thing. She was concerned because one night she heard a thud and he had climbed out, hit himself hard enough that she didn't like it. And so they transitioned him to a bed. We can talk more in depth about options. But if you were to work with me, I would insist that you not have him in a toddler bed, and we would have to come up with another solution. That is how strongly our company feels that 2 is too young to be in a toddler bed. And we can absolutely talk about that. I don't know if Chelsea and Lauren also have kids in this exact same situation. And I would want to talk to you about some of the other things surrounding that. But that might actually it might be making your situation harder than it has to be, because he has too much freedom for his age. Well, he or she, I guess I don't know. Yeah, he. Okay, sorry. Getting ahead of myself. So we can talk about that offline if you'd like to. I can pass along my contact information as well.
Awesome. Any other questions? Anything else that you were hoping to get answered tonight, but we did not? Okay.
You're welcome.
Yeah. Awesome. Well, hopefully, once again, everybody got some information. Once again, if you have any other questions, any concerns, or you're interested in more information, see if either one or both of us can help your child, don't hesitate to reach out. We'll make sure we get you in the proper place and see if we can help your kids as much as we can. Thank you again for your time. Really appreciate it. If you have any other questions, like I said, don't hesitate to reach out, and hopefully we'll talk to everyone soon. Thank you.
Bye, everyone. Thank you.